So, welcome to another episode of Beyond the Pelvis. Today, we are privileged to have with us Dr. Rebecca Kennedy, who is a family medicine physician in Portland, Oregon, specializing in mind body neuroplasticity based treatment for chronic symptoms. She works with any type of mind body symptom and has a particular focus on long COVID. She previously led the Kaiser Permanente Long COVID Clinic. After successfully restoring many patients to health, she left Kaiser in 2023 to establish her own clinic dedicated to this transformative approach. Dr. Kennedy also serves as a board member of the Association for the Treatment of Neuroplastic Symptoms. Welcome, Dr. Kennedy. We're so happy to have you here.
Thanks so much. It's really great to be here. I appreciate it.
Yes, so we would love to have you share a little bit more about maybe what you're doing or who you are today, and then share how you got into this space.
Yeah, I started my own practice a little over a year ago. Again, just focusing specifically on these chronic conditions, neuroplasticity, mind-body based, and it's been really exciting to really figure out how to build and grow this information. Work with patients. I work with them one-on-one. I also teach a class to be most efficient with people learning the information in a cost-effective way as well. And currently I'm building and expanding, and I'm building my team with a PT and a coach and actually a naturopath who uses the same exact approach as well. So it's very exciting.
Very exciting. So, I'm just curious. I'm wondering how you got into this space. How did you realize that there was some type of indication that the brain was involved in pain, that there was mind body symptoms involved?
I've been a family medicine physician for 25 years, and I think, family medicine physicians or primary care doctors, it's interesting. We're in this area in medicine where we're, I think, often thought to be not the specialist. So we often, sort of just cater to or not cater to, but we think about what the specialist tells us more than what we're looking at necessarily. And so maybe 10 years into my career, I just thought, what are we missing? And as a primary care doctor, we see patterns and we see the whole entire person. And so it was actually back when fibromyalgia was more of a diagnosis that was made a lot. And I just thought, I don't understand what we are missing because patients come in and they have a whole long list of medical illnesses that always seem to travel in the same sort of person, and there's no actually test that's negative or positive to diagnose a lot of these different disorders like fibromyalgia or migraines, irritable bowel syndrome, a lot of chronic pelvic pain, a lot of these different things. And in that same person was more likely to be mental health issues, anxiety, depression, PTSD, ADHD, like lots of different things, but yet it wasn't the cause of the symptoms. And it also wasn't caused by the symptoms. It didn't really have that same relationship. And also those people more likely had a history of trauma, maybe a lot of trauma, maybe less trauma, but it was just more likely, not always. But sending them to mental health actually didn't help. And so over and over and over, and again, as a family medicine physician, and I worked in a huge health system at Kaiser Permanente, and so I've seen probably, I don't know, over 70,000 patients in my career. And and so I just started looking for answers. I didn't understand why we couldn't help more than we did. And at the time, the only treatments really recommended for fibromyalgia was an antidepressant, like an SSRI, or Flexeril, a muscle relaxer. And, that was it. And I was taught to treat it with an SSRI, and I thought, why are we just slipping someone an SSRI, an antidepressant, and not even necessarily telling them that's what it is per se. I mean, it just seems so strange. And so I just looked for years and years and years. It was like this itch I couldn't scratch. And I was always reading things and taking, seminars and continuing medical education. And actually ended up at Harvard was one of the first places I ended up. And they have this amazing Mind Body Institute. And they describe what's happening physiologically in the body when we're stuck in the fight, flight, or freeze mode. And I thought, aha, yay, wow, this makes so much sense. I got it. And so I took it back to my patients at Kaiser and I was like, hey, I know now what's happening with your body. This is your nervous system, blah, blah, blah. But the answers which, lots of good things, but were just cognitive behavioral therapy, mindfulness-based stress response, and then, other sleeping well, eating well, getting exercise, connecting with friends, essentially. And I was like, hey, look at this. And then my patient said, yeah, I'm doing all of that. And I still have symptoms. And I said, oh, well, I don't know what to say now. Anyway, so I continued and continued. And fortunately, a very good friend of mine from medical school, I went to medical school in Michigan. I was talking to her, she was family medicine. And she said, oh, I send my patients to Howard Schubiner with chronic pain and they come back to me fixed. And I said, what? Wait, what? And I literally would not have believed it, except that it was my best friend from medical school and it was her own patients. So then I found everything I possibly could and started learning about this work. And I had a little bit of time in the integrative clinic at Kaiser, and so I started using these methods and this approach with patients there.
So I'm curious as to what was it that your particular patient, that one example you just gave, what was it that they were not doing or what were they missing
Hmm.
if they said that I'm doing all of that, yet
Mm.
Dr. Howard Schubner was having success with the same things? What was it? Were you able to figure that out?
It's understanding, well, a couple of things. Number one is I still thought that the symptoms were made in the body. I didn't know. I didn't know pain's made by the brain. And so I still thought so I still sort of focused too much on the body. So I think one of the main things is understanding that the body is actually not damaged. There is not a structural problem in the body. And I think that this is a huge piece. And I think as a physician doing this work is one of the pieces that often I can really help people with, is to really give them that information and that confidence that this is the alarm bell that's stuck in place, not the damage in the body, or the fire's out but the alarm's still stuck. So really understanding that it is the brain that has the perceived threat that then is sending the signal. But then we need to understand, well, what is the perceived threat? What is the brain fearing? And so also learning that and really understanding that it's about normal human psychology, that what my brain is doing is the same as your brain and the same as my patient's brain. We're no different. It's just that we've been through different experiences is all. And so then learning the patterns of how our normal survival unconscious brain works and then putting the pieces together about how our brain was primed as a child and the information that it learned meant threat, and then what's going on right now in our life, and how our brain is now responding to what's going on in our life as if it's threat, as if it's a predator, so then sending the signal down. And then within that, it's, sort of the repressed emotions, it's our thoughts, worries, and fears that our unconscious brain is actually repressing. So it's coming through our body. And so getting the emotions out, understanding the personality traits, and personality traits are protective mechanisms that our brain learned to protect us through our childhood. They were important then, but now our brain doesn't need it anymore, takes it too far, and then views it as a threat. So a lot of the patients that I refer to, I mean, live in Portland, Oregon, so they're like, my diet's fantastic. I eat nothing but kale. And, I do yoga, 5 times a day. I meditate, I blah, blah. Well, part of that is actually the personality trait of being too hard on ourselves and trying to do too much, saying yes. I have lots of patients, we were talking about before how awesome it would be to have a doctor ask you what's going on in your life. And when I sort of started putting these pieces together, I did start asking people, and I sort of sheepishly, because I didn't know how to say all this, so I would say, well, what about stress? I mean, are you stressed? Do you have stress in your life? And literally, I can't even tell you how many people would say to me, no, I'm not stressed. And I would say, okay, well, tell me about your life. Well, I have 3 kids, I'm going back to school, I'm taking care of my elderly parent, and my marriage is on the rocks, but no, I mean, I don't feel stressed. And so again, really putting the pieces together, and it's actually not the other answer to your question is what pieces are people missing is it's actually not our conscious awareness of what the stresses are. It's how our unconscious brain is responding to that. It's maybe someone has all of that in their life, but their unconscious brain is saying, oh my gosh, I'm a failure. And that's what their brain is responding to. And oh, I have to do more. I have to be perfect. I have to control everything. And these emotions of people not treating me well, I'm not allowed to express those. So it's really looking at what the unconscious brain is doing, not actually what the conscious brain is doing so much.
Mm.
That is one of the best explanations that I think we've had here.
Hmm.
How everything develops, the personality traits, the pain education. And I'm just curious, what other tools that you personally share with your clients to help them recover from these besides just, pointing it out and understanding how the brain works?
Hmm. I like to use an analogy of if your 2-year-old thinks that there's monsters in the closet, and so their fear goes up, and because they really believe that there's monsters in the closet. So as the parent, you go in and you soothe them and you say, "Oh, you're okay. It's all right. You're safe." And that is kind of all these tools to calm, our body, our nervous system. So kind of a lot of the things that I learned from the Harvard program, meditation, breathing exercises, whatever else you might do to sort of quote unquote calm the nervous system, all of those are fantastic. Great. I use those tools. But if you don't teach that 2-year-old that monsters don't really exist, then the amount of time that you have to spend doing all of those things to keep that fear down is like astronomical, right? And you have to actually sleep 8 hours a night in the room with your 2-year-old in order to get them to sleep. And who wants to do that? And who has the time to do that? So the other tools is really walking towards the closet and opening the door and showing that 2-year-old that monsters aren't really real. And those are the things that our unconscious brain is worrying about and interpreting that it's actually real predator, real danger that we need to show our unconscious brain. We can't just think it. It's a non-cognitive problem that if we're trying to solve cognitively, we're not going to get there, which is why cognitive behavioral therapy, I think, is not enough. It's an important starting place often, but so we have to show our unconscious brain. So the different ways that we show our brain is so with symptoms in our body is by moving our body and then coupling it with safe signals or doing visualization about moving our body if that's where we are or doing light touch or whatever it is, but we're moving it, we're sort of sending signals from the body up to our brain from that area. And then we're coupling that with safe signals. And whether it's saying out loud, I'm okay, I'm all right, I'm healthy, or I think it's particularly helpful to bring in sensations in our sensory organs that are safe signals because the information from the world we smell and see and hear and all that stuff. It goes through the base of our brain where the danger center is, away from our conscious awareness, filters through there first, it deciding if that means danger or safety before it even makes our conscious awareness. Sometimes it doesn't even get to our conscious awareness. So if we're smelling things or looking at things or listening to music and we're flooding that base of our brain, danger part of our brain, with safe signals, while we are experiencing the sensations in our body that don't feel good, then we're coupling that with safe signals. So we're rewiring that neural circuit that was created. And then the other part of the tools, different tools of opening that closet door, is repressed emotions. And often anger is repressed, and it's not always anger, but very often is. And especially for women, I think that it's not acceptable, and lots of different reasons, but teaching people to feel and express their anger, stand up for themselves, is a really important thing. When I was at Kaiser, I did this in the integrative clinic, but I also worked in primary care. I just did same day appointments. Essentially, I didn't have my own patients anymore at the end there. And I saw this woman, and she had back pain, and I was just a little sheepish, sort of like on the front lines of describing this information, and kind of brought it up and described to her, and she was living with her ex-husband and supporting him because he couldn't live by himself, and taking care of everything and their child and everything. So I explained this to her, and she left, and she came back, a couple weeks later, and she said, "I'm telling all my friends that I was diagnosed with rage." And I was like, right on. And she was doing great. She was expressing her emotions, stood up for herself. So, um, at any rate, so it's showing the brain that you're okay. And then the other tool is expressive writing. I find is really helpful. It's just a way to take those thoughts, worries, and emotions that are stuck in the unconscious brain, that are actually created by the danger part of our brain, and it actually brings it up to the prefrontal cortex, which is our higher thinking, so that we can filter these things through our rational thinking. And the writing part does that, puts it into that part of our brain, so that we can actually see it for what it is, and again get rid of it, and bring, sort of guide these thoughts and these worries and these emotions out, coax them out from our unconscious brain, show our brain we actually don't need to be worrying about what we think, what our brain thinks it does.
Mm. You brought up a couple things that made me sort of realize, or you described about how experiencing that uncomfortable sensation and coupling that with safety and grounding and bringing in other senses can sort of train or retrain the brain to see this as no longer a threat. And that was very similar to how I described to another doctor very recently about how I work with patients as a pelvic floor PT who experience pain. And I experience this often when I work with individuals one-on-one. And I had a very recent patient who had pain. Vestibulodynia was her diagnosis. So she just had pain at the vestibule and with any penetration. And it got to the point where she was able to recognize that physically she wasn't actually feeling pain at the location,
Mm,
right, around her
mm,
vulva, and it was actually
mm-hmm.
emotions. And she said, physically, I'm
Oh,
feeling
mm-hmm.
okay, and emotionally, no. And she started crying. And then we were
Mm,
able to get to the feelings that she was feeling, and it was shame. It was ultimately
mm,
shame that
yeah.
she was
Mm,
feeling, and it was
yeah.
it was
Yeah.
just so crazy to me. Although it happens quite often, and that is how I work, and I do explain that, we're working with the nervous system here. We're
Mm-hmm.
working with consciously being aware of what is subconsciously hidden. And
Yeah.
it's not the tissue themselves we're working with. It's just that's where the sensations appear, and maybe that's where the emotions are held. And what I'm not doing
Mm-hmm.
is manual therapy to massage out any
Yeah.
tightness or anything like
Right.
that. It's really just finding the
Yep.
trigger. Where is the emotion held? And up, there's the tears. There it is. Oh,
Mm-hmm.
there's the visceral response. You're feeling nauseous. What is that? What does that actually
Mm-hmm.
mean? And
Mm-hmm.
then I wanted to ask you, are these symptoms, whether it's migraines, fibromyalgia, we know for sure, and even long COVID, any of these other mind-body symptoms, are they mostly in women? And if they are not mostly in women, how do they differ between men and women?
Um, well, yes, they are predominantly in women, like with long COVID. So, and for the viewers, this might be a big sort of mind opener.
Yeah.
But long COVID really is neuroplastic. It's about perceived threat. And I say that with confidence because that's the main thing that I focus on. And I was the lead of the long COVID clinic at Kaiser. And so all 500,000 patients got sent through our clinic. We would do chart reviews, and there was only 4 of us. But so I've, really done a lot of studying about the science and the studies that are out there. But yeah, the predominant demographic of who has long COVID is actually not just women, but it's middle-aged women. It's
Mm,
in between the age of 30 and 60. So and that time period for a women's life, I think is, now that I'm in my early 50s, I think it's just one of the most stressful times of our life. Is so much to juggle working, but also taking care of the kids, filling out all the forms for elementary school as well. But taking care of the house, and even if you have a really great partner that helps, but then elderly parents, then the pressures of society, the unconscious bias of the sexism, and all the other pieces in there. It's just so much, and then all the pressures to succeed, and you want your kids to succeed and you to succeed, and all of that. So yes, the symptoms are predominantly in women, but not exclusively. I mean, I have lots and lots and lots of patients who are men, absolutely. um and I guess in terms of differences, um I mean, I wouldn't necessarily say there's huge differences, actually. I mean, again, I think the main differences is really the experience that someone went through in their life. Obviously, is going to be vastly, different for people, but how our survival brain responds to things is often very similar. I think that anger is not as acceptable for women as it is for men. So that particular emotion, sometimes for men, isn't there as much, but still I see it there quite a lot. And sometimes anger can be a protective mechanism to stop a man or anyone, but more often men, to stop themselves from feeling the actual emotion of feeling hurt. So it's sort of covered up with anger. And actually, conversely, it actually sort of, I thought about this when you were talking, is that tears are actually very often a protective mechanism that actually stops us from feeling the appropriate emotion of anger. And this was like this crazy aha moment for me. I mean, I spent my whole entire life just going to tears. I was a very shy child, and I mean, if we look at the hypersensitive people, like I probably would have been thought of as a highly sensitive person, and I couldn't even stand up for myself when I pulled my pants up and decided that I was going to, because I would just go to tears. So then I couldn't even communicate if I wanted to. And when I learned all this work, and so specifically the emotional awareness and expression therapy, that piece I think is a very, very helpful tool for this, is when I learned that, and that tears was a protective mechanism. I mean, it literally rocked my world and changed my life. And so after that, as like really the day after I learned this, tears came up for me. And I stopped myself and I thought, okay, what was my thought? Like, what was I just thinking that elicited the tears? And I have no idea what it was now, but it was something where I was being treated in a way that I didn't deserve. And I thought, oh gosh, anger is the appropriate emotion here, not sadness. Sadness is about connection with people. If if someone dies that we love, that's what sadness is for. If we're treated in a way we don't deserve, anger is the emotion. But when we are a child, our survival brain, it's not safe to let out emotion. I mean, to let out that anger, because we need to have social connection and with our parent, and they're a lifeline or we'll die. And then if someone doesn't treat us in the way we deserve, anger is to stand up for ourselves. But now, if our parent treats us in a way we don't deserve, or, the person taking care of us, well, that's not safe to rise up with anger because we could break the social connection that is our lifeline. So, from our survival standpoint, our brain says, oh, it's not safe to actually express anger. So, a child goes more to sadness and tears, which is a weaker state that's safer from, again, our survival standpoint. That emotion doesn't go away, but it gets turned in on ourselves, and then it gets created as depression or anxiety or shame. So very, very often I see all the time, and as well, I'm sure you do too, is that shame, actually, when we look at it, it's actually because of what someone else did to us, not what we did to someone else. And then and so again, it's misdirected anger that then gets turned in on ourselves.
It's interesting. I have a lot of clients that are men. I'd say almost a quarter of my clients are men, and most of the time it's because their anger was repressed. They weren't able to feel it.
Mm, yeah.
And
Mm-hmm.
now it's about them getting their voice back, being able to
Mm-hmm.
stand up for themselves. What do they
Yeah.
want?
Yeah. Right. Mm-hmm.
And the
Yeah.
other comment I wanted to make is I actually had COVID a few years back, and I had a thought that came in my head. Oh, I hope it's not long COVID. And
Mm,
I pushed the thought away really quick because I had
yeah.
pelvic pain. So I've had a history of mind body symptoms, and I know not to think that,
Yeah.
right? So
Yeah.
after a couple weeks, I started feeling better. And then
Mm-hmm.
I realized it was staying.
Mm.
And I literally, through my own pain education, I talked myself through it and got myself back to health slowly,
Oh,
taking short
amazing.
walks
Yeah.
and keep telling myself, nope, you're fine.
Mm.
Viruses go
Mm-hmm.
away, viruses heal within
Yeah.
3 to 4 weeks. And the symptoms just slowly faded away.
Oh, amazing. Awesome.
I'd
Yeah.
love for you to talk a
Yeah.
little bit more about long COVID. What does that mean? What does that show up as? Because I know, like, that's one of those where it's like newer, fibromyalgia, people can understand, oh,
Mm-hmm.
fibromyalgia. But long COVID,
Mm-hmm.
I can see people getting offended about, oh, that's my
Mm-hmm.
body. I'm doing this. Because that's where
Mm-hmm.
people go when they realize their
Yeah.
symptoms are mind body, is they internalize it and they they feel shame, like I am doing this to myself, and then they want to attack or
Mm,
defend themselves. So can you talk about what long COVID is and how it shows up?
absolutely. So when I was at Kaiser, again, we filtered 500,000 people, all the people with long COVID. We reviewed their charts. And I started doing this back in 2021. So it was actually at a time when not everybody had had COVID yet, and not everybody had had the vaccine. So I was assessing patients that were saying to me these things. I wasn't saying this to them. People said, oh, well, I had COVID and now I have this whole constellation of symptoms. Okay, fair enough. Maybe long COVID. And then people said to me, well, I actually haven't had COVID yet. And it was early enough on that they actually had not. And they said, well, I just had the vaccine. I didn't even have COVID. and I have these symptoms. But here's the interesting part. People said to me, I did not elicit this from them, Dr. Kennedy, I didn't have COVID, nor the vaccine. These are the same symptoms I had prior to COVID, but they're worse, and they are the symptoms of long COVID, right? So very early on, I mean, it was already clear to me, being a physician for 20 years, that, this whole pattern, because it's the same symptoms, frankly, of fibromyalgia or, all these different things. And actually, if you look back at PTSD or shell shocked, or I mean, you can look back thousands of years and you look at that list of symptoms, and it's actually very similar. Palpitations, POTS. Actually, POTS was described like thousands of years ago. Um, your GI system getting turned down, dizziness, pain, inexplicable pains, insomnia, anxiety, depression, shortness of breath, all of these symptoms are really the symptoms of the nervous system being stuck in fight, flight, or freeze. It's a nervous system issue, not a damage in the body issue. So again, if we look at the pattern, and now actually there's huge studies. There was a study out of the University of Michigan of 3 million people. I mean, it was a chart review, but of 3 million. And they found that chronic overlapping pain conditions, like what you described, Flora, is, fibromyalgia, chronic fatigue syndrome, sort of this constellation of symptoms actually predisposes someone to getting long COVID. But also the interesting part was that the risk was increased like 47% or something after having COVID. But the risk was increased over 50% by not having COVID and having the flu.
Yeah.
And then the risk was actually increased of having long COVID, having the diagnosis of long COVID, and they actually didn't even have COVID nor the flu. So, and another study of 3,000 patients showed a similar thing in Australia, that many people with long COVID, or it actually didn't matter if you had COVID or the flu, your risk of having long COVID was the same. So again, it's not about the COVID virus itself. There's nothing about the COVID virus that's creating some sort of damage in the body that no other virus has done, but it's the threat response by the brain, and having the brain stuck in fight, flight, or freeze. So, and there's also huge studies of hundreds of thousands of people that show that having a history of anxiety or depression or PTSD also predisposes you to then developing long COVID. And, that doesn't make sense if it's something like, diabetes or, some sort of structural problem in the body. The other thing is, if this is about damage in the body, right? And so, okay, you have COVID, the virus maybe has these little spike proteins and it's doing something. Well, then why aren't the predominant people who are getting long COVID elderly and frail and sick? Why are they robust triathletes in their 30s? Right? Again, that just doesn't make sense that it's about damage in the body. Because again, people who are frail and sick are more predisposed to getting damage in their body from something. And then the other piece of information is, why do the symptoms come and go? Why are they move around the body? It doesn't come and go for absolutely every single person, but very frequently someone might have symptoms for a while, and then it gets better for maybe a day or a week or months even, and then the symptoms come back. Well, if that's happening, and that pattern can go on for years with long COVID. Well, if that's the case, and it's because of blood clots or spike proteins or viral particles or whatever it is, well, where'd they go? Where'd they go for 2 months? And then they came back. Again, it just, all the pieces, as you put all the pieces together, it just doesn't make sense. And if you look at the vaccine trials of the COVID vaccines, the placebo arm of the vaccine trial, 35% of those people got side effects. Okay, so they got no vaccine, they got saline, and 35% of them developed side effects, the same side effects as the people who actually got the vaccine, because our brain is strong, because our brain, the expectation and prediction is what creates our experience. I mean, it is mind-boggling to think about.
That is
So,
crazy.
so one other little piece I want to say is I came to this work because of being a physician looking for my patients. Once I found this work and I was working at Kaiser, I don't know, I think once you see it, you can't unsee it. So I'm going to work. I know that this is true, but I only had a tiny little half day a week, and people could see me for free because I was like in the system. So I had hundreds of people, I was inundated with. And I wanted to help them, my people pleasing personality, because I have all the personality traits. I'm like, oh my gosh, I have the answer. I can help these people, but yet I couldn't help them because I didn't have time. And then I did everything I possibly could to reach out to leaders. I met with the chief of cardiology and neurology and primary care and all this stuff, and no one would listen to me. And then, and it's hard too. And so then people were offended, a few of them, less than I thought they would be. But then some people were offended and they sent me nasty emails that was in the whole system for everyone to see. And I'm the good girl. I don't make waves. And here I am making big waves. And so then I got symptoms. I got chronic pain and fatigue that was really, really bad. I could work, but that was it. I mean, I really couldn't do much else in my life. I mean, I had fiery pain over my whole body. I didn't sleep. I couldn't even push myself up off the ground. I could barely stand up from my stool at work. I had to try to fake it. I mean, it was pretty crazy. But because the thing is, this is not about the conscious brain. That's the thing. It's like if I asked you, "Hey, make your fingernails stop growing right now." Right? I mean, it's about the unconscious brain, and the unconscious brain takes up 90%, maybe even 95% of our brain matter. Our conscious brain is this little tiny p of 5% of our brain. So it's a wonder that we have any agency over our lives, frankly. But so again, once you start putting those pieces together, and when you stand back again, coming back to being a primary care doctor, of standing back and looking at all of the pieces, it just does not make sense that long COVID is because of damage in the body. The studies that show that are they actually haven't shown it. They haven't been proven, and they're very small studies, much of them. Some of them are actually not even scientifically valid studies, the way they did it. And again, they haven't been able to be reproduced. But the really massive large scale studies actually do reinforce that this is a nervous system brain issue, not damage in the body issue.
I think we have to really be careful too, as mind body practitioners, with any type of diagnosis. I know that I have to be careful. I don't want to offend some of my friendships or things. I'm like, have you ever looked beyond that? What's happening in your life? And, they'll say, my symptoms are real. And
Oh,
it's
yeah,
yeah, it's a fine line, that you don't
right.
offend anyone. And I find that I am extremely grateful that I had the pain science, that I was able to reverse the long COVID and realize that it was just a thought in my brain
I
that
know,
caused that. And if you think about it,
right.
how many other people are thinking that, oh my God, I hope I don't get long COVID?
Yeah, right. Absolutely. Right. And if we look at the COVID pandemic, it was the most stressful thing that we could have gone through as a human being. Like, again, from our survival brain standpoint, we could be young and healthy and we could die from COVID. And our safety net that we don't even think about, we take for granted, the healthcare system actually isn't even available. We can't even go to the ER. And we can't connect with other humans. We can't see their faces even. That gives more safety to humans than anything else. There's no end in sight. There's no getting away from it. It's around the whole world. There's financial ruin, the environment, political stress. I mean, every single piece of it. And speaking to what you said earlier, Keneal, is there was so much shame wrapped up in even just having the COVID virus itself, which you didn't even have control over, right? Like you put all those pieces together, is that it makes perfect sense that we're experiencing long COVID because, again, it's really more like PTSD from having gone through this really, really stressful time. And when you have a bathtub full of stressors throughout your lifetime, and people ask me this all the time because they're like, well, I did actually get long COVID when I actually had the COVID vaccine. I mean, virus, well, the vaccine too, but I mean, yes, right? That happens, but that is the last drop of water in that bathtub that's full that then makes it spill over. And again, also, like you're saying, Laura, you add in all of the expectation, all of these messages, these fear messages that we're bombarded with about long COVID. And then you just add that to the mix in the danger part of the survival brain. And then it tips it over the balance.
Hmm. So this might be a really big question, but all of this sounds like a society problem, right? It's the stress, the anxiety, the depression, PTSD, trauma and stress. Like these are all things that have been put on us, pressures that have been put on us. And I speak generally for anyone who's ever experienced any of these symptoms, which I'm sure some people or a lot of people experience some form of mind-body symptoms at some point in their lives. Maybe some more chronic than others. What do you see as like the ultimate solution to this? Can we fix it just by let's gain some control over your conscious brain? Let's gain some control
I
by
love
meditating,
this
pain science. Like,
question,
yeah, where do
right?
you see it going?
Oh my gosh, I love this question. And I mean, I go to sleep and I wake up thinking about these things.
Yeah,
Absolutely. And actually, I want to say a couple quick things. Number one, every person on this planet has mind-body symptoms. Everyone, right? Because we're human. It is the
right.
human condition. That's it. And yes, exactly. Some people it sticks in chronically and overwhelming, and other people it's, a tension headache because they had a really rough day at work, right? But the other thing is I want to just make sure to point out is that all the symptoms are real, and whether or not the generator of the symptoms is some sort of structural damage in the body or the brain perceiving psychological stress and threats, the symptoms are the same. I mean, if you have a broken hand, the reason you have pain is still made because of danger in the brain. So it's still made the
Yes.
same way. It's just what the generator of it is. And often the symptoms that are mind body neuroplastic, that there's no damage in the body, are actually far worse than actually literally damage in the body. My son just split open his lip a couple days ago playing basketball. It was all splayed open and he has 7 stitches. It was like 3 days ago. And last night he said, oh yeah, my lip doesn't hurt. There's no pain. And he also got hit up here, so there's a little bit of swelling that we didn't notice initially. And he was like, oh yeah, this hurts up here, but oh my lip feels fine. And still like swollen out here because his brain doesn't need to protect him anymore because pain is a danger signal. It's not a tissue damage signal. And that's really important. I have patients that cannot get out of bed. They can't barely talk and listen to sounds. They have coursing pain through their body, much like I did, and it is generated by the brain. And it is a radical idea to think about that. But getting back to your amazing question, I think that the answer is teaching people how to process their anger. And when we really step back and think about, and this really helps me, is that fear in the unconscious brain is the driver of everybody. That's it. That is the driver. So when I think about someone in my life doing something that makes me mad, I feel the anger. I express the anger by myself. This is what EAET is. I feel and express it by myself because I deserve to feel that emotion. But then I also deserve to let go of it. And I let go of it by getting to self-compassion and self-love. And it's very, very hard to do. A lot of people, myself included, and pretty much all my patients, did not learn that self-love as a child because of whatever they went through, right? It's a human condition. But then getting to the understanding for the other person in order to let go of the anger. And letting go of the anger does not mean that you're saying what they did is okay What it means is that you don't deserve to suffer anymore. You don't deserve to carry it around with you, and that you can let go because of your understanding of humanity. And it is hard being a human on this planet. And I think that if we could teach this tool to everyone, the fighting in the Middle East, our politicians, our, who people in our life, everyone, if we, in the school level, if we can teach people to feel and express their anger in a healthy way, it would radically change everything. I mean, I think about in my own life what I taught. I have two teenage sons, and what I taught them, one of them in particular, as a child who was particularly fiery and really squashed his anger and his emotion and said, oh, that's not okay. It's not acceptable in school. And, oh, go to your room. And it just kind of makes my heart sink. I mean, he's doing fine now, but that's not the right message, right? It's, you deserve to stand up for yourself. You deserve to feel this emotion. Now let me guide you and teach you a way for you to learn how to do that in a way that you don't hit someone or bite someone, or find your words to stand up for yourself in a healthy, strong way. So.
So, I help people with pelvic pain mostly, other conditions as well. But speaking of anger, if we look at the anatomy of the pelvis and the jaw, they're
Mm,
extremely similar. So when I
mm,
help people with pelvic pain, I don't
fascinating.
usually focus on the pelvis. I focus on the jaw. What have,
Mm,
where's their voice? What haven't they said?
mm,
What anger hasn't been
mm-hmm.
expressed? So mostly
Yeah.
people with pelvic pain have
Mm-hmm.
a very tight jaw. And I'll
Mm,
always check on my jaw throughout the day a lot to see what's happening.
yeah.
Is there something I didn't say? What needs to be
Mm-hmm.
expressed? So
Mm-hmm.
it's, anger is such an important emotion and it helps us create boundaries. It's just the problem is
Right.
sometimes we hold on to it.
Yeah.
Mhm.
Right. Mm-hmm.
Yeah, I was just thinking it sounds like the solution is grace for ourselves,
Yeah.
compassion for other people, and then
Yeah.
setting boundaries. It all comes down to like, it's so basic. Like, who would ever think that setting boundaries, loving ourselves, and having compassion for other people was the cure, we can say that,
Yes.
for mind body
Mm-hmm.
symptoms that shows
Oh,
like
yeah.
pain, real life
Yeah.
pain,
Yeah.
fatigue, whatever it is,
Mm-hmm.
having some grace, having some compassion, and showing some love. It seems really simple, and I can see people getting offended about that because it is that simple, but it doesn't make it easy to do because being human is
Totally.
hard. Being a human
Yes.
is
Right.
hard.
Yes. Right. Exactly. And actually showing yourself self-love often is very hard, and actually getting to
So hard.
starting there, because again, it's about the survival brain. And if the survival brain didn't get shown that as a child, then we put up these protective mechanisms. And those are the things that we have to teach our brain that we don't need anymore.
Hmm.
Yeah, right.
I wish we could talk to you for hours and we didn't
I
even get a
know.
chance to talk about some of the other things that we planned, and hopefully we can maybe have you back at some point.
Yeah,
Um,
I'd love to.
but I'm just curious if you could, leave our listeners with just even one tip, one bit of advice, and what would that be?
Um, after, all the different things I said today are important, but is understanding that once you figure out that the symptoms, the generator of your symptoms are neuroplastic, brain generated and not due to damage in your body, you can get better. And I mean, every single person I've worked with probably, and including myself, questions if they can get better. And they look at other people and like, okay, I hear this testimonial. Well, they could do it, but I don't know that I can do it. And just knowing that pretty much everybody has that question and doesn't think that they can. So, and it might take a long time. might take a short time. Every path is different, and it can take a while sometimes to really figure out for you what are those stumbling blocks. But with, again, getting down to that grace and love for yourself and compassion and joy is the starting place for everyone. Always come back to that.
Thank you.
Yeah.
Yes.
Yeah.
I think this will really resonate with a lot of people. I think this is quite helpful. So we just want to thank you for speaking with us today and sharing everything
Yeah.
you've had to share. And I'm sure people are going to want to reach out to you. And can you share how people can do that?
Yeah, my website is resilience-healthcare.com. Yeah, absolutely. My
Thank
Thank
pleasure.
you.
you.
It's just amazing to connect up with you. I love to hear about the work that you're doing. So important. Uh, yeah, my pleasure talking together.
Yes,
Yes.
same. Thank you.
Thank you.